CDC expecting a normal flu season this year after cases dropped to a record low last year because most of us were stuck in the house or self-isolating. 2 children have died so far this flu season of type A influenza. Now 7 states are seeing higher flu activity. Joining us right now, Dr. Timothy Quinn of Quinn Healthcare, who is here to help answer some of our questions. Good morning to you, doctor. Who should be the most concerned about the flu this season?
Well, the people that should be most concerned are vulnerable individuals. These are individuals that are elderly, greater than 65, those with chronic medical conditions, and also little children, because these individuals typically have less of a robust immune system. So if they contract the flu, then they have less of a chance to fight it off effectively, and there's more of a chance that they could actually lose their lives.
Well, and we're seeing a number of flu cases this year. We're seeing more because we're out in public life much more than we were last year. Obviously, people are still masking up in public spaces, indoors, in many cities across the country. But what are some other ways to prevent the flu from spreading?
Well, one of the most effective ways to prevent the flu is to get your flu vaccination. That is so effective, and the research and the data has been overwhelmingly proving that this is so. But also just remember the protocols, such as masking up if you're out in public, especially with this new Omicron variant of the coronavirus. But if you are sick, stay home and try to go and get evaluated by your medical provider. Now, at our clinic, what we do is we do a test that tests for the coronavirus and the flu all in one nasal swab. That's very effective. And surprisingly, we are diagnosing a lot of people with flu this year. We actually diagnosed 3 people with the flu on yesterday. So this is something that we really need to consider.
But I think that you're also dealing with a lot of vaccine fatigue from some people. They're thinking, I've already received my coronavirus vaccine. I've already received my booster. Then I got to go back and get my flu shot because I hadn't done that yet. Because a lot of people actually put that to the side in 2020 with everything that was going on. So 40% reportedly of people think that the flu vaccine is effective. So that leaves 60% of people who do not plan on getting their flu shot. What is your message to them?
We just have to keep educating and encouraging. And one bit of good news is the CDC did put out a report stating that when you get your coronavirus vaccine, you can get your flu vaccine the same day. Just get it in the other arm. And this really, really helps with convenience, because a lot of Americans right now are very busy. They are very hesitant about going to different places where a lot of individuals are, such as doctors' offices, because they fear they'll be exposed to coronavirus. So making it so that you can get the flu vaccine and the coronavirus vaccine in the same day, that just gives us one more weapon to try to encourage people to get those vaccines that they really need.
All right, Dr. Quinn, as always, thank you so much for being with us. Thank you so much for watching. Make sure to click on the red subscribe button below so you can get more of NewsNation's fact-driven, unbiased coverage.